Back in the 1800s, an orthopedic surgeon named Jack Joseph decided that he was going to take down somebody's hump by cutting right across it. And he essentially started the first structural rhinoplasty technique. And that is going up here, cutting across the hump, and then of course this area needs to be reconstructed. And as a consequence, if the cutting or the reconstruction is not very well, you'll have issues. Things like valve collapse or an open roof deformity. And this is not in everyone. In expert hands, structural rhinoplasty can have outstanding results. Another thing with structural rhinoplasty is that often we take a lot of the septum. The septum is the part in the middle that separates the two sides of the nose. And we use it for grafting. That grafting is generally for reconstruction of this middle part and the tip. And when you take a lot of the septum, and if you have to go back to revise that nose, then A, you don't have any septum to work with, and B, there is a lot of scar tissue in this area because of the destruction of this area and then later reconstruction of it. So revisions are a lot more complicated, requiring rib grafting, etc. We actually published a book chapter on the topic that I'll reference here. In 2018, Dr. Yves Saban of Nice, France, reignited interest in preservation rhinoplasty. It had been done before, and it was done for a while, but it didn't gain much popularity because it was complicated to perform and difficult to teach. The idea is this. Up here you have the nasal bone, and then here you have nasal cartilages, and they work in a joint-like fashion. And when we go up here and destroy that, well, we're destroying that joint. And the idea was, if this structure, this bony cartilage joint sitting on top of the septum, if we create space, remove some of the septum, then the hump can come down. Okay, that comes down, but it doesn't become straight. If we do other maneuvers, then we can straighten that joint. So decrease the hump size and open it up to be a straight or even concave line along the dorsum. That sounded like an amazing idea. In fact, this idea is similar to one of the demolition ideas used in Japan called the Kajima demolition. So imagine a two-story building. How can we make this a one-story building? If the two-story building represents the height of the dorsum and we want it lower, how can we do this? One way is to go destroy the top floor. Then of course you would have to reconstruct the roof of the first floor because it was the floor of the top floor. The second way is to destroy the bottom floor, place hydraulic jacks, and gently bring that top floor down. Then there is nothing to reconstruct because the roof of the top floor is intact. That is the concept of preservation rhinoplasty, where we take away some of the septum and we push the hump down. Oftentimes we don't even have to elevate the skin. Is it appropriate in all nose types? Of course not. This is why a consultation is so important, to see if you're a good candidate for this type of surgery. I hope I was able to answer some of your questions about preservation rhinoplasty, and if you have any additional questions, feel free to reach out.